Good evening. Let's start our case presentation on the story they told us when we was young. Our story of creation. There was Adam and Eve. They were living in Eden heaven until Satan crept there in the form of a snake and told them to eat from forbidden tree. Our journey then starts. Sorry? Sorry. Hi, presentation. Okay. So, in the story of creation, they told us when we was young that there's Adam and Eve, and they were living in Eden heaven until Satan crept there in a form of snake and told them to eat from the forbidden tree. Our journey then from there starts. 30 years old male came to our quadrality complaining from reduction of vision of the left eye for 6-week duration. His vision was 6.6 on the right eye and 6.36 on the left eye, corrected to the 6.18. IOB was non-significant. All other ophthalmological examination was normal regarding the anterior segment examination, except for the fundus picture. There was gray-white lesion around the optic disc, creeping to the macula like a snake. The fundus autofluorescence picture magnified this lesion and let us see it well. Hyperfluorescence lesions reaching to the macula. Our differential diagnosis is idiopathic serpiginous choroidopathy, or serpiginous-like lesion, like TB choroiditis or syphilitic choroiditis, or progressive outer nuclear necrosis. Serpiginous in English mean creeping or spreading, literally healing over in a portion while continuous to advance to other, similar to the story of Adam and Eve. What to do? Patient sent to do OCT for macula, complete blood picture and ESR, chest X-ray, tuberculin test, and Vidal. The results show OCT hyperreflective lesion, mainly at the outer retinal area and retinal pigmented epithelial area, similar to the picture of acute attack of serpiginous choroidopathy. In a complete blood picture test, we see that the white PC count was within the normal, so we exclude the progressive outer nuclear necrosis because it occurs mainly at the patient with immunocompromised. Chest X-ray was negative or clear. Vidal was positive but weakly positive. The test that was very helpful for us, tuberculin test, which saw strongly positive reaction about 18 millimeter area. So we sent or referred the patient for clinic or TB clinic to establishing the tuberculosis regime treatment schedule and to be seen within 3 weeks duration. After 3 weeks, the picture shown, there is a regression for the lesion. The lesion appeared to be less hyperfluorescence, more hypofluorescence, so it is moved to the chronic side. And this picture for fundus autofluorescence before and after show a big difference due to responding of the patient to this regime. The head of snake was cut, like a story, and at last there are some things go with our diagnosis here and something not going, like things that going that Iraqi is endemic with TB. Tuberculin was show strongly positive result, and responding of the patient to the TB, this goes with our treatment. Things that not going with our that lacking of anterior chamber reactions and lacking for of vitritis. Thank you.